Okay, guys, so let's be real. Who likes scars? No one, right, Jenny?
That is absolutely right. Our friends at GBMC have innovated their approach to the operating room by limiting the amount of scarring a patient will have after surgery. Here to tell us more is Dr. Sara Fogarty. Thank you so much for being with us.
Thank you so much for having me.
Of course.
So who is a good candidate for hidden scar surgery?
Sure. So hidden scar surgery is really a method that we use to limit scars in women with breast cancer. Women that 30 years ago would have terrible scarring and a reminder every day of the cancer they had and the treatment they went through. So hidden scars are really basically taking out tumors with small scars, and we try to hide them in places like your armpit, around the nipple, or underneath the breast, so that they're hidden better. You still have a scar, but they're smaller.
Yeah, and nobody's going to see them, especially like if they're in a crease or something, they're not going to be visible.
We try to always keep them in bathing suit lines, you know, away from cleavage lines, just to make them less noticeable, so that, you know, really no one would know you'd had that surgery. And it's really great for women to not be reminded every day.
Your overall confidence as well.
Right, especially when they're doing so well, you know, a decade after surgery, after all their treatment, they don't have to look at their terrible scars and say, oh my gosh, you know, I went through this. So it's something we all try to do. And with the hidden scar procedure, we use new technology with these lighted retractors to help us see, so we can actually tunnel up to the tumor from these small incisions to remove them. So it's very safe, and it's something that you know, train with these new lighted retractors to be able to complete.
Gotcha. So not all surgeons are doing these.
No, I mean, everyone strives for small scars and to have patients, you know, obviously cosmetics is very important in breast cancer treatment, just because the treatment now is so good. Women do so much better. They live so much longer. We want people to be happy with how they look. So cosmetics is very important to all of us.
For sure. And who exactly is a candidate? Can anybody with breast cancer get this type of surgery?
Potentially, yes. Really, it depends a lot on the tumor location, tumor size, how large someone's breast is or how small. I basically tell every patient I meet with that I always try to make my scars small, and I try to hide them if I can. It's not a guarantee, but we try very hard to do that for everybody. Mastectomy or lumpectomy, there's ways of hiding the incisions for either type of surgery.
So is there a stronger reoccurrence for the cancer to actually come back after the surgery?
No, not at all. As long as you adhere to the same principles of, you know, making sure all your margins are clear, that there's no cells left behind, and you've removed the entire tumor, then no, there's absolutely no difference in recurrence rates.
That's great. So tell us again where these incisions might be. So you mentioned the armpit.
Sure. So you can do a small incision under the armpit. You can do an incision underneath the breast in the crease here. You can make them small or long. For my mastectomies, I tend to use they're called inframammary incisions underneath the breast. And that way you can actually remove the entire breast from under the skin. And that's how we try to do it when we do nipple-sparing mastectomies, where we don't have to remove the nipple like we used to. And that cosmetically looks amazing. And then you can also make incisions around the areola, that colored part around the nipple, and those scars heal very well and are very hard to see.
So how long is healing time? Does it just vary depending on the person?
It's the same as any other scar. I mean, you know, in the first week or so, incisions heal very well. We do stitches that dissolve. There's no stitches to remove. Of course, absolutely never use staples, anything like that. So everybody's different, but people heal very well with these incisions.
It's good to know.
Yeah, so talk to us about the BRCA gene, and if somebody has tested positive, does that affect their ability to get this type of surgery? How does that work?
No, not at all. So our BRCA mutation carriers are women that are at higher risk for getting breast cancer. We have a lot of BRCA mutation patients who you can still undergo lumpectomy if you're diagnosed with cancer. It does not mean you have to have mastectomies. Some women opt for that as prophylaxis for the other breast, so they'll have bilateral mastectomies, but that's not, you know, a requirement by any means. You can do the same incision for BRCA mutation carriers or not, as long as you're removing the tumor and making sure you have, you know, clear margins. It's very safe to use.
And is this the same for preventative methods as well as for treatment methods?
Yes, so if you're doing prophylactic mastectomies, we try very hard to always do nipple-sparing mastectomies for all of our genetic carriers or for prophylaxis in women that are high risk. Inframammary incisions are what we strive for, and we try to do nipple-sparing. There are some reasons some women can't have that, so I can never guarantee. I always have my plastic surgeon evaluate them as well to make sure that they're candidates for that procedure, but that's what we try to do.
Yeah.
So really cosmetically, people have no idea that you've had that surgery.
It's awesome.
That's wonderful, and I know so many women appreciate that.
Absolutely. I mean, this information, it's great. Where can our viewers find more?
Yeah. So there's a website. You can look up hidden scar surgeons, and the surgeons that are certified are listed there by zip code. So you can look us up and see who does these procedures. It's something that, you know, I talk to everybody about and let them know that that's what I try to do. Sometimes I have patients that when I see exactly where their tumor's located, it's not possible, but we still try to do very small scars and hidden. And that's something we all have done for a long time.
You're awesome.
Yes, thank
Yes.
you. Definitely talk to your medical professional if you're interested or think this might be a good thing for you. And of course, you're a certified surgeon who does this, so you can check the GBMC website if you want to learn more. Thank you so much.
Thank you.
We always
It's
love
great
when
to
you
see
come on our show.
Thank you.
Yes.
It's great to see you guys.
Always a good
Thank you.
time.
Right?